Hi everyone, welcome back to ilovepharmacology. In this short tutorial, let's learn about the selective estrogen receptor modulators, which are called as SERM. So the objective of this session would be, let us understand the selective estrogen receptor modulator classification, which includes clomiphene, tamoxifen, raloxifene, ospemifene, or meloxifene, and their uses as well as the adverse effects. So coming to the SERM, so basically they are having estrogenic agonistic activity in some of the tissues, and also they have antagonistic action on the other tissues. So usually agonistic action is beneficial in tissues like bone, where there will be decreased resorption, which prevents the progression towards the osteoporosis. It has got agonistic activity on the blood, which helps in the better lipid profile, and it has got deleterious effect or dangerous effects on the endometrium as well as the breast, as it increases the risk of breast cancer as well as the endometrial carcinomas. On the liver, it can predispose to thromboembolism. So, so they have got both beneficial effect due to estrogen, and also it can antagonize its adverse effects as well. So coming to the clomiphene, tamoxifen, deloxifene, tormifene, fulvestrant, raloxifene, bezadoxifene, ospemifene, and ormeloxifene. So in humans, clomiphene has got estrogen antagonistic action in hypothalamus, where it reduces the feedback inhibition of GnRH secretion. So basically the clomiphene is used in the treatment of anovulatory infertility by increasing the GnRH release. The major adverse effect of the clomiphene is it can cause hyperstimulation syndrome, which can lead to polycystic ovarian disease. So thereby it can lead to multiple pregnancy. So coming to the tamoxifen, deloxifene, and tormifene. So these drugs possess estrogen antagonistic activity in the breast and agonistic activity in the blood, bone, uterus, and the liver. So basically, since it has got antagonistic activity on the breast, it can be used in the treatment of breast carcinoma. It has got beneficial effects on bone lipid profile, but it increases the risk of endometrial carcinoma and thromboembolism. So coming to the tamoxifen, tamoxifen can be remembered as 3Bs, which has got beneficial effects. It reduces the risk of breast carcinoma, it improves the HDL and decreases the LDL level in the blood, and it decreases the bone resorption rate. So coming to raloxifene and bezadoxifene, which are particularly used in the treatment of osteoporosis. Raloxifene possesses a beneficial effect with respect to the lipid profile, breast, and the endometrium. The major adverse effect can be due to increased predisposition to thromboembolism. So coming to the centochromine, which is also known as ormeloxifene, it is used as a non-hormonal oral contraceptive, which is also called as Saheli. So which has been approved for the treatment of dysfunctional uterine bleeding. So coming to the ospemifene, which is a newer selective estrogen receptor modulator, which has been indicated in the treatment of dyspareunia due to menopause. So these are the objectives which we covered in this class: classification of SERM, the uses and adverse effects of tamoxifen, clomiphene, raloxifene, ospemifene, ormeloxifene, and their uses and the side effects.